The results are quite interesting because they show that acalabrutinib is more effective in comparison with the other two regimens. And so the PFS is not reached, while instead the PFS for the other two arms is around 16 months, very similar between the two, chemotherapy or not. But this is also associated with a better toxicity profile, so we don't have all the side effects that are known to be part of the treatment with idelalisib. So almost 50% of the patients treated with idelalisib plus rituximab will develop diarrhea and colitis. This is much less and definitely doesn't bring to colitis when you use acalabrutinib. There is the typical headache with acalabrutinib, which is anyhow transient, and then there is some neutropenia, like also with chemotherapy. But overall, the typical adverse events of BTK inhibition are much more less frequent, meaning that, for example, bleeding, which is a very common side effect with other BTK inhibitors, here is present only in 1/4 of the patient, 25% of the patient. There is a low frequency of atrial fibrillation, around 5%. Of course, all these adverse events have to be evaluated also with time, with a longer follow-up, and then we will see if this will be maintained.